never know how you might end up. But of course, this is the fam right here on KYS. Quicksilver.
Danny Star.
DJ 59.
We were reading a study, and we warned if there's any young people in the car right now. Not that you can't hear this, but we're just putting the precaution out there to any parents who might not want your kids
It's grown
to hear
folks talk.
certain things. Now, right now, with marijuana being very popular in D.C., because of many reasons. Some say because the whole legalization of it, and now if you have a car, you can buy it legally. But the study says that a lot of young people under the age of 21 are smoking too much marijuana, loud, weed, whatever you want to call it, and it's causing effects sexually. And we actually brought in a doctor who's going to actually kind of break what's happening. What's your name, sir? Introduce yourself to D.C., Maryland, Virginia, please.
Good morning, DMV. This is Dr. Jeffery Dormu, originally from Washington, D.C.
Washingtonian,
stand
baby.
up.
So just break this down. When I read the study that said a lot of kids are smoking too much weed and now they can't perform in bed. That means that they can't get up. Is that for men?
This is a real thing?
It's a real thing. It's keeping me busy in the office, for sure.
I bet.
Wow. I'm not that mad about it, but got to pay the bills.
Yes, exactly.
Right.
But erectile dysfunction, okay, so that's the word, the scientific word, which is basically refers to the inability to be able to get and maintain an erection firm enough to have sex.
Get up.
Seeing younger and younger people having this problem.
Really?
And it's related to marijuana use.
I always thought this was like an old man thing. When you get old and all of a sudden over the age of 60, 70 or something, you can't. Like, this is happening in 19, 20-year-olds?
Yeah.
Because of weed smoke?
I mean, weed smoking is becoming more and more popular. It's on our music. It's, every time you look around, smoke weed
Light it
every
up.
day. So,
Wow.
Okay,
Rest in
Doc.
peace, Nate D.O. Double G.
absolutely. The thing is, there's consequences to that. The key is usually moderation in most things you talk about. I tell most of my patients when it comes to smoking, including marijuana smoking, there's no such thing as moderation, okay?
Really?
Oh, yeah, including cigarettes. I mean, these things will collapse your vessels, your arteries, and nothing functions without blood supply.
Right.
If your vessels are clogged going to your brain, stroke.
So
If
all
it's-
smoke. What about hookah smoke? That's popular right now. Everybody's
All of
smoking
it,
hookah.
all of it, especially if it's unfiltered. Okay, I mean, you hear about cigarettes causing lung cancer,
What about vaping?
vaping. I think I know what that is. Oh, you're talking about the.
The
rather
e-cigarettes.
than like the e-cigarettes, or rather than like you're actually
Okay.
smoking
Well,
it from
tobacco.
your paper.
It's a
I'm not
vapor.
going to down that because that's people are doing that so that they can get off of cigarettes.
Yeah.
Okay, okay.
So I mean, anything to get you off of it. I mean, I'm for it.
Yeah.
But cigarette smoking, marijuana smoking, I mean, it affects your hormones. It affects the vessels specifically. Heart attack. I'm pretty sure we know some people are dropping dead of heart attacks and strokes in that age range of 18 to 45, which is
So we hear a
unheard of.
lot like nobody's ever died from weed. Do you think that's a myth?
It's a big myth. Okay,
Wow.
this is scientific evidence.
Yeah.
Okay.
Overdose from weed?
Overdose. You can chronically get your vessels clogged, which will cause heart attacks.
Right.
I can get into it more specifically,
Right.
but basically what it does is it closes your vessel or it collapses your vessels, which makes the heart work harder. The heart rate speeds up, puts you at risk for a heart attack.
Wow.
Gotcha.
Same thing with stroke.
Now,
Wow.
with men in the erectile dysfunction side of it, are there effects like that sexually for women as well?
Not as much for women.
Okay.
Lucky women, y'all can go ahead and smoke all you want. Just
Stupid.
go ahead, Danny. Go ahead.
Stupid.
Light up, Danny. All you want.
If there's a question that women are dominated sex, I'm telling you they are. Okay. Well, when it comes to women, I mean, it affects the different hormones. Okay. One thing that marijuana does is increase the dopamine effect. This is where you get the high feeling.
Yes.
Okay. Now that usually gives you a drowsiness, and a lot of people after they smoke weed, they have no desire to have sex. Okay, so a lot of them go to sleep.
Yeah.
We hear about that, or they get the munchies. Okay, so it decreases the mood. Okay, and then if you want to talk about psychologically, I mean, hallucinations go with it.
Yeah.
Long-term effects, schizophrenia, psychosis. So if you know some people who smoke weed, you're like, oh man, you're quite
Right,
moody.
You're crazy. Forget
Yeah,
everything.
you're crazy.
Now, here's the question. You said that your office has been busy because this has been happening and now a lot of people need help. What exactly is the answer? So now, let's just say right now I've been smoking weed my whole life, and now I can't get up, and I'm 23 years old.
Yeah.
What's the answer
So
now?
the
Because I want to
answer
fix
is-
that. I don't want to be like this
no
for the
doubt.
rest of my life.
No doubt. So the answer is, first of all, just getting knowledgeable about it. So this is the beginning. So then you can slow that down. I mean, it's not easy to stop smoking, but once you know about it, you can.
And if you know
stop
the
that.
effects, because I don't think a lot of people know that. So once you start to actually, like you said, when you're educated on the effects of what it's doing to your body, and especially men are very sensitive about their genitalia.
Absolutely.
So I
my
think-
thing can't get up. I might stop
Absolutely.
smoking.
Yeah.
I
Yes.
smoke cigars.
Listen,
That's fine.
listen.
That's right.
But I'm good. I'm sorry. never
You
mind.
are
I'm
so
sorry. I'm
ignorant.
sorry.
Sorry,
That's
Doc.
old.
Ashley's
all
very
right, no
happy.
problem.
Ashley's very happy. So.
Yeah.
All right.
But treatment. Okay, so if the vessels are collapsed or blocked, okay, sometimes it causes shrinkage of the vessels, which also puts it at high risk for getting clogged. That's my specialty. We unclog the vessels. The name of my centers are Minimally Invasive Vascular Center, so we can do it without having to cut you. Most people hear
Wow.
about surgery and they like, oh, I'm not going to a surgeon.
Nope,
But
and no.
we go in with the needle puncture hole and basically
Clean it
roll
all
the
out.
rooter. Clean it all out. Rotor rooter.
Gotcha.
We clean out the vessels.
Rotor-rooter.
Educate you and get you on the treatment plan so this don't keep occurring, because it's breaking up marriages.
I bet it
Hey.
is.
A domestic
Can't
violence.
figure out
is
why
up.
I'm not happy. I can't get up.
And
I'm
I'm
smoking
right
all
here,
this
single
loud.
man,
all upset.
single man right here who don't
That's right.
smoke.
And that
I
will
could pick up the
harm a
pieces.
man's
That's right.
ego.
Picks
And
up
if she
the
ain't
pieces.
happy, the household ain't happy.
Right?
Fact.
Happy wife, happy life. Thank you,
Exactly.
Doc.
We appreciate you coming in. How can we reach you more? Social media or any contact you want to leave for all of DC, Maryland, Virginia? For anybody that's going through that right now, and I know a lot of men who might be dealing with this, they don't want to be disclosed.
Yeah.
I make sure I come to your office, and I don't want everybody knowing who I am.
Doctors are private.
Absolutely. HIPAA.
Yeah,
HIPAA.
exactly.
So MIVCMD.com.
Gotcha.
Okay, you can get on the website, or 301-497-1590.
Doc will have
you.
you standing at attention, boy.
Oh yeah.
I'm gonna post all this
Just
stuff
saying.
KYSDC.com right now. So if you need help and you couldn't figure out what it was, but you smoke a lot of loud, now you know. Thanks to
thing
the
I don't
fam in the
smoke.
morning, you are now in the know. Thanks,
Yeah.
Doc. We appreciate you, sir.
Yo. The fam in the morning. Yo.